It's a diagnosis no one wants to get, and that's cancer. But there is something you can do to help keep the disease away. Dr. Ed Hughes from First Dayton CyberKnife is here to tell us what we can be doing, what you at home should be doing as well. And what is that?
Well, I think it's an important phrase. Exercise a day can keep your cancer away.
Ooh, I like
and
that.
we all know that exercise is great at preventing heart disease and stroke. We've known that for decades. But in the last decade, there have been a number of studies that show that exercise can do two things. One, it can prevent many cancers. There are a lot of studies done. These were pioneered in Scandinavia, where they studied tens of thousands of Scandinavians for decades. And we know that exercise can prevent colorectal cancer, it can prevent postmenopausal breast cancer, uterine cancer, cancer of the womb, probably prostate cancer. The data is not as good. Certainly not lung cancer. That's still the same old story.
Sure.
Stop smoking. So that's one big benefit of exercise. And the other big benefit, and this has been really exciting over the past few years, is that once you have cancer, continuing to exercise can also help prevent a recurrence.
Well, that makes sense. So don't stop just because you get your diagnosis.
Absolutely. The studies in colorectal cancer and breast cancer, you're looking at a 25 to 30% reduction, 25 to 30% reduction in recurrence if you continue to exercise.
So what kind of exercise should we be doing, and specifically how much?
Well, I don't think you have to run a marathon. That's for sure. Let's face it, cancer is a disease of seniors by and large. But what we do know is that the amount of exercise has been well studied, so that we know, for example, that 3 to 4 hours a week is better than 1 to 2 hours.
Okay.
It sounds like a lot of exercise initially, but when you break it down, what we're looking at is 30 to 45 minutes a day, 6 days a week, take Sundays off.
Okay, so vigorous exercise, but we don't need to be running marathons here to prevent cancer.
That's true. What we don't know is aerobic exercise, for example, walking, swimming, biking, is that better than strength training, yoga, Pilates, something I do. So what I say to my patients is hedge your bets. Let's alternate things. You don't want to get tired out. So that on Monday, Wednesday, Friday, you'll be doing aerobic exercise. You'll be alternating biking with swimming, with brisk walking, which is probably the best way to go. And alternate that Tuesday, Thursday, Saturday with some form of strength training. It doesn't have to be big weights. We're looking at 2 to 5 pounds with a lot of repetition. Pilates, yoga, stretching, those are all great ways to keep exercising. And the main thing is to vary it up and know that it takes really a couple of months for those habits to build. But it's a lifestyle change that can pay off big benefits, almost as much as taking the chemotherapy or taking the radiation therapy or taking anti-cancer pills. And a lot cheaper.
Well, sure, cheaper. And, you know, it also can release endorphins, make you feel a little bit better, too, mentally, physically.
Absolutely.
What if viewers want more information on the subject?
Well, I've started a blog recently.
Oh, great.
I entered medical school in 1974, so I think I learned a lot along the way.
I'll bet you did.
And so I started a blog. You can get that on our website
Okay.
at firstdaytoncyberknife.com.
Perfect. That's at the bottom of your screen there. And thank you so much for these great tips. I think that it's great for any of our viewers watching, diagnosed or not. Keep exercising and living a healthy lifestyle regardless of any diagnosis.
Thank you, Katie.
Thanks, Ed.